Good evening to you all. My name is Samantha Nyangumbe. I will be presenting roles and responsibilities of the registered nurse, which include recent changes and their impact on the roles and responsibilities of the registered nurse. Role of the Nursing and Midwifery Council, the implications of code on nursing practice, the need of effective communication in a multidisciplinary healthcare setting, and the effectiveness of the multidisciplinary approach to nursing. Nurse. Define a nurse. The nurse is a person who has completed a program of basic generalized nursing education and is authorized by the appropriate regulatory authority to practice nursing in his or her country. Basic nursing education is a formally recognized program of the study providing a broad and sound foundation in the behavioral, life, and nursing sciences for the general practice of nursing. For a leadership role and for post-basics education for specialty or advanced nursing practice, the nurse is prepared and authorized to engage in general scope of nursing practice, including the promotion of healthy, prevention of illness, and care of physical ill, mental ill, and disabled people of all ages in all healthcare and other community settings. To carry out healthcare teaching, to participate fully as a member of the healthcare team, and finally, to supervise and train nursing and healthcare auxiliaries. We move on to the next category, which is the recent changes to the roles and responsibilities of the registered nurse. Nursing has been widely accepted as one of the most trusted and honorable professions for many decades, and rightfully so, with a long history of delivering personalized, high-quality care. Nurses are often seen and experienced as angels on earth. By then, medical schools have been formed, MD degrees were awarded to any student who participated in the lecture, only 16-week-long course schedule. During that time, doctors could graduate without ever touching a patient, and there was no such thing as school for nursing. Then we move on to education. Education of nurses are drastically changed over the past several hundred years, but what about the practice itself? No longer reliant on home remedies or traveling physicians, nurses are more equipped than ever with a wealth of scientific advancement and a greater level of autonomy. In just the last 50 years, nurses have traded in their white dresses and stockings for convenient scrubs. Patient recovery times for many procedures have been shortened, allowing nurses to enjoy greater efficiency and more emphasis on outpatient care. Perhaps one of the most notable recent changes in nursing practice since the 1970s is the increase in diversity of ethnicity and gender in nursing profession, creating an even larger and richer pool of talent and experience. But the faster that society moves, the faster changes seem to happen. And the last decade has brought more recent changes in nursing practice than the previous 50 years. The most significant change in nursing over the last 10 years has been nursing education. More universities has offered specialized degrees, while training has become more formal and complex. At the same time, this education has become more accessible. As Bachelors of Science in Nursing degrees have become more and more standard expectation, schools have created more attainable ways of earning them through online programs, flexible schedules, and even assisting with clinical placement. In addition to earning higher degrees in nursing itself, some nurse leaders are opting to round out their education with Six Sigma certifications, business and strategy certifications, and other management-related classes to grow beyond their MSN training. As nursing responsibilities and roles continue to expand and demand for nurses increases the ability to access health of a whole community. Then we move on to the next category, which is technology. There seems to be no industry that is safe from the breakneck speed at which technology evolves, and nursing is no exception. Not only have patient records shifted from primary paper to primary digital, other tools like mobile monitoring devices, smart beds, wearable devices, and mobile apps have all been added to nursing arsenal and been named important recent changes in the nursing practice. Then there is also telemedicine. It's on the rise, particularly in rural areas, and nurses are expected to keep up with every technological advance as it comes. Technology continues to relentlessly advance, which will not only change patient care but nursing education. More automation, mobility, and access to remote care are anticipated to create a new atmosphere in the nursing landscape. Then, as health technology evolves, nurses serve on the front lines of applying the latest advancements to serve their patients with increasing efficiency and effectiveness. Monitoring. Portable monitors give nurses the freedom to check on patients quickly, even when occupied with other tasks. We have medications. Nurses in most healthcare settings no longer need to make rounds to monitor patients' IVs, as smart pumps allow for more accurate and efficient administration of medication and fluids. We have health records. Through the use of EMRs, nurses and other medical professions can quickly access critical patient information and reduce or eliminate the need for paperwork. Beds. Smart beds allow nurses to monitor patients' weight, movement, and vitals, which can help prevent bed sores, injuries, and misdiagnosis. Then we also have reduced errors. Technology considerably reduces the likelihood of error in logging patient information like allergies to medications, medical history, and health conditions and illnesses. Communication. Today's nurses use team collaboration tools, instant messages, and headsets that allow them to communicate with their colleagues in real time. Then we have also the telehealth. Patients can increasingly access medical professionals, including nurses, from the comfort of their homes, thanks to mobile apps. Then we also have the impact of COVID-19 as another change. Nursing and midwifery professionals have played and continue to play a critical role in COVID-19 response. The nursing and midwifery COVID-19 catalogue of change includes a wide range of case studies from nurses and midwives from across England, sharing ideas and innovations that they have put in place and that they have made a difference in these difficult times. Reflecting to day-to-day practice as we now adapt to working in different ways to continue to ensure the highest delivery of care across communities and organizations. Then we move on to the roles and responsibilities of a registered nurse. The first one is innovate their practice to suit the needs of the patient. Registered nurses are well versed in medicine. One of their many duties in healthcare facility is to make sure that their patients are comfortable. Personalized care is one way to achieve this goal. The second one is to assist in surgeries and other medical procedures. Registered nurses are not authorized to practice independently. However, they can assist physicians and surgeons during complicated medical procedures. Doctors cannot practice to perfection without the help of nurses. They need an extra set of hands to help them in various medical procedures. Then we move on to the third role and responsibility is to emphasize with the patients. Empathy is important. Patients must know that you understand the extent of their discomfort due to their illnesses. Educate other nurses. Sufficient experience of RNs allows them to train the new nurses who have recently started to practice, provide bedside care. RNs provide medical care to patients in the hospitals after doctors check their symptoms and prescribe medication. And we also have the use of technology to provide healthcare in remote areas. Technology has allowed access to healthcare in every part of the world. Telehealth is one of the latest technology trends in healthcare that has changed the world for the better. Now we move on to the role of regulating bodies, which is the NMC, Nursing and Midwifery Council. It is a professional association that regulates and represents nurses and midwives in the United Kingdom. It has a statutory duty to manage and monitor the register of nurses and midwives. It also provides advice and guidance, undertaking research and producing reports on matters relevant to its work. The Nursing and Midwifery Council is the UK's professional regulator for nurses and midwives. It was established in 2002. It also registered qualified nurses and midwives who meet these standards and monitors their practice to ensure they continue to meet them. Then the role of NMS is to protect the public by making sure all nurses and midwives are safe with up-to-date knowledge of their practice and meet the standards set out in the code. They also need to be able to practice safely and provide care, upholding professional standards of practice and conduct. NMC is responsible for setting standards in the UK to make sure that all nurses and midwives are safe with the right knowledge, skills, and attitude. Then we move on to the responsibilities of the Nursing and Midwifery Council. NMC exists to protect the public, and all nurses and midwives must follow its guidance or they will face disciplinary action. It regulates the profession through the following. It ensures all nurses and midwives meet certain standards of practice. It is responsible for the regulation of nurse education, training, and registration. Can take action against those who do not meet the standards or who provide misleading references. Then the NMC has a duty to protect the public and make sure that registered nurses and midwives meet practice standards and show evidence of safe and effective practice. Nurses and midwives from overseas are registered to fit practice the role they've been licensed for. All nurses must submit revalidation every 2 years by the last day of June. Then we move on to the code. The code presents the professional standards that nurses, midwives, and nursing associates must uphold in order to be registered to practice in the UK. It's structured around 4 themes: prioritize people, practice effectively, preserve safety, and promote professionalism and trust. Each section contains a series of statements that, taken together, signify what good nurses and midwifery practice looks like. What is the code? The NMC has updated its code of professional standards. The revised code became effective on the 31st of March 2015, and all registered nurses and midwives are required to uphold its standards of practice and behaviors. The code is centered around 4 themes with public protection at the core and builds on the existing foundation of good nursing and midwifery practice. The code should be used as a living guide at the heart of everyday nursing and midwifery practice. Then we are moving on to the role of the CPD, continuing professional development. It allows you to maintain professional credentials and develop your skills through short courses or on-the-job training. In nursing, it is used to help staff keep pace with sector advancement, new treatments, new technologies, or approaches to care, so they can deliver high-quality, safe, and effective care in all capacities and settings. As a nurse, CPD will play a significant part in your profession and personal development. Through CPD and other training, nurses can continue to meet the health needs of their patients in advanced and efficient ways. Then we move on to the revalidation process. Revalidation process is the process of keeping all nurses up to date with relevant skills and knowledge during their career. This includes ensuring they are informed about new evidence, changes in practice, and legislation that affect the care patients receive. All nurses must submit revalidation every 2 years by the last day of June. They will receive a notice confirming that they are due for the revalidation at least 6 months before this date. If they don't meet current standards, they can be removed from the register or have restrictions set for their practice. Then we move on to the effective communication in multidisciplinary healthcare setting. Effective communication can be defined as verbal speech or other methods of relaying information in order to get a point across. Effective communication within a healthcare setting is critically important. Workers of varying skill sets within a healthcare setting must communicate clearly with each other to best coordinate care delivery to patients. Then, multidisciplinary team. This is a diagram which is showing the multidisciplinary team. You can see there is an HCA, the physio, and OTs, the doctor, the nurse, the social worker. You cannot work as one, but you need others to work as a team so that they will work, or the communication will be effective, especially when you work together as one team. The effectiveness of multidisciplinary approach in health setting refers to an approach that involves the integration and collaboration of different academic disciplines or fields of study. The aim is to combine insights and approaches from multiple disciplines to generate more holistic and impactful results than what could be achieved by a single discipline alone. Then we have advantages and disadvantages of a multidisciplinary team model. Frequently, the advantages are it frequently follows a medical pull-out model. Professionals comes together for student planning, but not with great frequency. Focus is on individual disciplines, assessment, and intervention. Then the disadvantages of this type of model: assessment done in isolation and may not be reflective of students in the classroom. Therapy is direct, but often isolated. Professionals work independently, but with limited time to share information. Decisions are usually not made through consensus by team members.